All right, so April 30th, day before May Day, and Health and Welfare is back online. We're looking at H91. Our lead council was delayed a little bit, so we're going to turn to Commissioner Winters, who is here. And so Commissioner Winters, thank you for being available to us and helping us look at any you started going through the bill with us last time, and we can continue to do that. But also, I know that you've had a conversation with interested parties and have made some progress on decisions that would help us. Thank you very much. So if you don't mind starting with that,
Sure.
Maybe we'll other places.
Okay, thank you, Madam Chair. For the record, my name is Chris Winters. I'm the Commissioner of the Department for Children and Families. And as you said, last week we got bumped, but we all went upstairs into the cafeteria and sat around one of the round tables and had a really long discussion, trying to figure out if there are areas that we agree on. This with the community action agencies. I won't pretend to speak for them today. I'll give my version of what I think we're agreeing on so far, and we were able to have a follow-up meeting yesterday to talk about that a little bit more, to try to concretize here a little bit of the sort of the things that we do agree on in concept, at least. One of those is the timeline and the preservation of the HOP program as it is. So both making sure we have enough time for a successful transition and that we take it incrementally. That's important to the success of making this big shift from a state-run emergency housing program to something that's run regionally by the CAPS. And so in timeline, and also just the concern that I think you all have heard, both from CAPS and from non-CAP community partners about not interfering with the current HOP programs that are working so well and supporting a lot of our shelter and homelessness. So in a timeline, we agreed that HOP should continue as is for at least the next 2 fiscal years. So in FY26 and FY27, the HOP program is still administered through the Office of Economic Opportunity. And then you're planning along over those 2 fiscal years for a transition into the VHARS program in fiscal year 28, which would combine the emergency housing funds with the HOP funds and just be one housing and sheltering fund. It's a whole continuum of housing. It's not just GA emergency versus shelter and as separate programs. So that would be the timeline. I think where the question is with GA, with general assistance, is DCF continues to run it through FY26. Can there be a transfer in FY27? So July 1st, 2026, would we be prepared, and would the community action agencies be prepared to take over the running of what's now called the hotel motel program in a different way than it's run now? And so does the funding transfer with that, positions transfer with that? I think that's where the devil is in the details around what happens in FY27 with GA. And so that's where the implementation and planning over the next year becomes really important. And we kind of walked through some of the things that we thought should be in that planning and implementation process, and can we start moving on that right away? We get a report to you all earlier than February 1st is what the bill currently contemplates.
Thinking about what day?
October 1st is what we've thrown out there. And I think there's a lot of question around that. Like, does it need at that point the legislative stamp of approval to do anything, come up with a plan on October 1st? Do you all want to revisit it then? Is it something that we can continue to work on, and you'll see it on January 1st? But the thought was, get the thoughts out. Who are the core services? Who are the populations served? What sort of infrastructure do we want for this? How do we start moving forward sooner rather than later? Because then we can make the transitions. So I think there's still more detail to be worked out there on what the achievable timeline is for reporting by October 1st and then getting a transition. What can we transition to by July 1st of 2026? What pieces could be put in place?
Go ahead. Who's first?
I can be quick, I think. I was wondering, and this may not be a question for you, Secretary Winter, maybe it's for Katie, I'm not sure, but homelessness doesn't present itself the same way all over the state, and the numbers are obviously the same across the state, and I'm wondering what's in the bill to sort of make sure that the funding allocations are equitable depending on the need. Is there, you know?
So there's a piece in the bill that talks about a needs assessment. And we had, some dialogue about, when does that needs assessment have to happen? The needs assessment, we're continuing HOP for 2 fiscal years. The needs assessment is really around what are we doing with the GA program and the GA funding starting in July 2026. Do we hand over a GA program that's the hotel motel program as it is? I think we'll have some suggestions about what we do about that program in the coming fiscal year. And that's in the big bill, not in this bill. But that needs assessment can determine like how many shelter beds, how many medical respite beds, how many family shelter beds, how many low barrier shelter beds, how can we use hotel and motel, what about domestic violence, what about emergency extreme weather? Those needs assessments can inform what each region is going to need and then how the funding should flow. So that's each region needs to plan for that in the coming year. And I think that's where they're asking for additional funding and positions to be able to do
Do
that.
the needs assessment
To
and
do the needs assessment, to do the planning, to start community
Right.
engagement.
will you ultimately take their findings and sort of aggregate and put it all together?
Yeah, for a statewide plan. And that's kind of it's somewhat what we do with the HOP funding right now. If we don't, people apply, organizations apply for funding and we have to look statewide and say, maybe Chittenden County already has this and Addison County doesn't have this. And so we kind of try to distribute those funds equally across the state, depending on the need, not equally, but according to need in each region. Yeah, that's something that we already do with HOP funding. And I think would happen on a bigger scale. And
Awesome, thank you.
Yeah.
And voice my concern that this program has been a perpetual pain in everyone's side, at least going by my emails. And once we spin it off to the CAPS, and we aren't getting the emails every April when I am concerned that our incentive to adequately fund it will go away. I also, as part of this analysis, I'm not sure all the CAPS will want to take it on. All CAPS are not equal. So what do we do if they don't? But even if 3, 4 of them take it on, we've got startup money, and assessment money, and planning money, but it's one time. We aren't doing away with any state positions or offices. So we are now going to have 3 or 4 different groups, but they are all going to need 1, 2, 3, 4. They're going to need ongoing people to manage a program of this size. So we're setting up 5 different administrative clusters. And unless we're increasing the funding or we're sure we're going to be decreasing the cost in an equal amount, we're going to be taking money out that is presently available because we only have 1 administrative hub. We're going to be taking money that's available now to fund the program to fund multiple administrative. And I just want to make sure that when we're planning a program, we also plan a budget. And I think it should come back here because I think we should know that this is what because it's been the numbers that have been the problem. If we have lots more money, it'd be a lot fewer emails enabled. So I think that's what I want to make sure gets into part of this analysis is the financial analysis.
So that's going to be very important that we pay attention to the bottom line and the money that we do have available. And that the hope is that this program costs the same or less than we're spending now on the hotel motel program, and that money is invested in much more effective ways at the local level. As the GA program goes away for DCF, those positions can go away. And that's part of the planning, I think, is what can we transfer. That's not just the base budget and the one-time funding that goes to pay for hotel rooms, but the 3 administrative positions that we have in ENSD, or the many limited service positions that we're paying for, or the call center that we're paying for a vendor for. All of those things would no longer be needed in economic services that be transferred to.
That's the numbers I need to see.
Yeah, just if I could just reiterate or put a fine point on it, but yeah. Make sure the money is going to direct services and not administrative and bureaucratic work. It's important, but
That's language that we need to ensure is in the bill.
Yeah.
Yes, that is the kind of language that needs to be in the bill, and it includes in that a reduction in dependence on hotel. And so it's going to be a difficult process. We know that.
And just to say again that there will always be a place for using hotels and motels in the system. It was a very small piece of it 5 years ago, and it was backup, and it was the adverse weather piece that when shelters were full. Regionally, this puts the decision making more in the hands of the local communities, and we could decide that they might use hotels and motels in a different way. Great announcement yesterday. The Downstreet is converting a hotel in Barrie to be more shelter-like, so where they'll have services on site. And that's a great model that communities might choose to their piece of the GA funding. You could maybe say that's how we want to spend it.
So what I'm hearing you say is that the recommendation from the group, I'm hearing it from DCF and CAPS and some of the community partners. Is that accurate?
Yes.
Okay. To maintain hops for 26 and 27 at OEO. And then in 28 to have a process that will be determined to combine hops and caps of these, there's hops and caps. And then during 27, the GA will transition to the caps but in the meantime, there will be a planning process that goes on, and we want to ensure that we have language in there that offers fairness and implementation pieces. So planning for implementation and have an October 1st report here, October 25, so that maybe there'll be some legislative responsibility there, maybe not, but at least we'll be given some heads up. Looking at what is needed to put infrastructure in place by July 26th, that will also influence either the BAA or the budget itself. That there is concern expressed about population-based needs assessment in different parts of the state, differences in types of housing needed, whether it's respite, low barrier, extreme weather, what types of housing is needed as the GA is integrated into and with the CAPS. And then the perspective on reducing the motel hotel dependence or transitioning it to something new and different and less
That's right.
Okay,
Thanks.
so those are the things that we've heard. I hope I've captured that because our ledge counsel is in the room and she's awesome.
Can I add one more thing?
Oh, yeah.
I know there's a lot of concern from the community, the non-CAP community partners about HOP and their existing
Yeah.
programs and worry about when that funding is flowing regionally, will they have some assurance that they can continue doing what they're doing? One of the things that we have thought about is that no existing HOP program changes without DCF having some role in that decision making. So it's not just the CAPS deciding such and such how funding is ending for a particular program. I know there's a lot of trepidation and uncertainty from a number of our really valued and trusted shelter providers that things could go differently under this bill. We thought maybe there could be a DCF backstop in there somewhere that no HOP funding ends without some sort of DCF involved.
So having oversight, AHS oversight overall, I think should be considered, not just for HOPS and HOPS funding, but also for as the transition to CAPS and for CAPS. No, if it's going to be, if they're going to be sort of a designated agency for our homeless programs, then some oversight would be needed. Something.
Thank you.
Is there anything else? That was a productive cafeteria.
It was, yeah.
I
Thank you
think
for
we
suggesting.
would like for you to do that again. But, seriously, invite, and I think having the local community partners engaged in this is critical because they're the ones who are very concerned about what's happening to them or could happen to them. Is it possible that you can do that?
We can, we have quite a relationship through OEO with all of those folks. We haven't kind of called them together on this. We focused on community action meetings. We have a weekly meeting. We're trying to see where we can agree and where we might have disagreement.
Oh, that would
But
be
we
good.
can certainly do that with
That would be good. That would be great. The hallway meetings to me are really critical. So,
Yeah, ultimately, we want to make this work, and there are a lot of moving pieces in here, a lot of unknowns. So there's a year of planning, and then there's a year of what transition, and then
yeah.
it's going to take us a little while to pull this all together. But I'm really kind of excited about the prospect of doing something very different from what we're doing with the hotel.
And so I just want to say thank you for what you're doing on this. I know it's part of a larger set of tasks that you have. It's really important. I do have one more question, and I don't know if it was addressed by the group. And that is within the bill itself, there's this big statewide advisory committee of multiple numbers of folks. And I'm wondering, as going through the implementation process and looking at the 5 CAPS and, obviously the questions, some are may be more ready and capable than others. That's a question that has to be asked within the larger group. But my question is, does it make sense to have, and maybe this is at the end of the planning process, but does it make sense to have regional advisory groups or regional support groups? So including the DAs, SSA, the local shelter programs. So to have that in place rather than the big statewide, I look at the statewide because, but obviously you have to have people with lived experience and all of that, but does it make sense to think about moving that down to the regional advisory process rather than maintaining it out there at the state level? And for me, the state level becomes the AHS oversight, and then the advisory piece is at the local level to ensure that the needs are being met there. Something to think about. That's something I've been thinking a lot about. So, do you have your hand up?
I do. Thank you, Chair Lyons.
Yeah.
I really appreciate that. And because I do think each region is kind of idiosyncratic. And I think in my region, for example, there are certain communities that have shelter beds and then certain communities that don't and don't want them. And if we had sort of concentrated local focus, then we might be able to push
Yeah.
some of those. Whereas like if it's statewide, I'm not sure if they would know the ins and outs. I was gonna say the politics, but so I don't know what do you.
Yeah, I totally agree. I appreciate I guess the intent behind the advisory committee, but it's really big. And it's hard to pull those together. And I'll just say, honestly, we didn't have a great experience with the task force last year. We did such a broad mandate, in so little time. I think there are a number of things in the planning and implementation that we can crank out fairly quickly. And then have that public process be the local level and involve municipalities, for sure is another.
Yeah, I forgot this municipalities, that's so critical. Senator Lewis, right?
That's where it's gonna eventually fall back.
Yeah, exactly.
Yeah.
You do. I see a lot of people shaking their head, yeah, so I'm hoping that we can get to this place, at least to figure out how to get there. I'm thinking that if I were a CAP, I would want to know what's going on in my region, and I'd want to know between now and 27 when I got the whole lump.
Yeah.
So we'll do
And
that.
they have a good sense for what's going on in their region, and they know who to pull to the table. And they have a lot of access to people with lived experience like that. They can do a much more effective job, I think, locally than we could do in a statewide meeting.
So, and then I have another question before we get you out of the hot seat. So I know that the agency had made some suggestions about RFP and having an RFP go out and have some kind of a process like that for this. And it doesn't sound like that is part of what you're talking about at this point.
No, we had initially thought that, like, how
Yeah.
do we make sure, should this be a competitive process?
Yeah.
But in order for the CAPs, and you should ask them about this for sure.
Yeah.
They need some certainty. They need to rely on like year-to-year planning. And then if we do build in, what are the performance benchmarks? What are the measures? What are we expecting? And if they're not meeting that standard, could there be some kind of a de-designation process? If they're not able to, if they're not up to the task and they just don't have the staff or they just don't want to do this any longer, is there a de-designation process we can do with that? Put it out to bid for someone else to step up?
Is that something that we need to put into this bill? Or is that something for consideration? For either October 1st or another report back?
Maybe in the report, that's my initial thought, but let me get back to you on that.
Yeah, please do that. Yeah, that'd be
Some
great.
language there.
Yeah. I don't know whether we're ready to even, to put language in. We could put language in that says, help us understand what would have to happen.
But I do think the CAPs are the best position, best suited to be able to do
Yeah.
this. It's a big ask.
Sure it is.
But I think we're getting to a place where we're all getting more comfortable with how it could possibly work. But we should have a backup plan if for some reason a particular community action agency isn't able to do this. How can we move to someone else to serve that role?
Okay. Yeah, the backup plan seems. We don't want to disenfranchise a region. Okay. Any other questions? So any further progress that it's a lot smoother to have solutions come in here rather than our taking testimony and then trying to put all that testimony together and then have everybody testify again on the solution that we've structured. So if you can bring us more solutions, and then as we've worked with Ledge Council to put language together, then everybody can come in and tell us what we've done wrong. That's the usual process, right? Maybe some other things. Thank you.
Thank you.
Great work. No, terrific work, right? And I know the people in the room who have been part of that discussion greatly appreciated by everyone on the committee, really. And just the last comment is never the last, but one of the concerns I think that's been expressed is, and we're going to hear about this as we go forward and present the bill to the full Senate, or other folks start hearing about the bills. You're not really saving money. You're just adding more administration. The fact of the matter is it takes a little bit of time to turn $60 million or $70 million into 30. I mean, that's where we are. We've got $30 million for GA, $30 million for HOPS, $10 million for the work to make it all happen with the caps. And we want to turn the temperature down to get to 30 or lower. But we want to build shelters. We want to provide services. We haven't talked about intake yet, but we probably should do that. Maybe that's something you can help with.
Happy to, Senator. We had talked with the caps a little bit about this. It's
Okay.
something we'd like to start in GA at like 26.
Okay,
And then have an assessment, a more robust assessment process into GA starting in 27 through the caps.
so if there are any decisions on that, and any of the decisions that you have to get us something in writing and even
Okay.
suggested language would help.
Sure.
That'd be great.
Happy.
Okay, thank you.
Thanks.
Committee, anything else we've missed with the commissioner? Okay. Is there, I don't like, I'm afraid to do this, but I'm gonna do it anyway. Comments around the room. Just sitting where you are, a brief comment that you'd like to make on what you have just heard. And we'll start over here with Amy.
Amy Schollenberger, representing VCAP. I just wanted to say for the committee that I think Commissioner Winters represented what the agreements were so far in the meetings that we've had between the CAPS and CF and OEO, just so you all know that. And just a small comment on your question about the advisory committee. We believe it's not necessary to have that statewide plan group, and that a lot of that can happen in the regional planning. And I think what we talked about is coming up with sort of a template for the regional planning for the October 1st report, so that then you could approve that rather than putting language into this bill. So that there would be agreement between DCF and the CAPS about how the regional planning and the regional assessment and creating the work plans would happen. So there's some consistency around the state for you all to see whether it is equitable or not. And then the backstop of them approving the work plans that we did do.
So are you suggesting then if that the language we'd have to put language into another bill going forward?
I don't know.
That's-
I don't know if you would need that or not. I think if you liked what we came up with, it could just be done that way.
Yeah,
If
no,
you
I
didn't like
understand.
what was
but
what
If we
came
like
back-
what you come up with and then over time it starts to change.
Yeah.
We can refer to statute and say, wait, this is the intent here. So
I think that's a
think
decision
about
for you.
how we might put something in here that is a little more solid. So that we don't have to come back and revisit something like that again and again.
Yeah, I think you might put something in the language around the October 1st report that you want
Yes,
that part of the plan.
Yeah.
And then in October, you could decide whether you need more legislative language.
we'll think about that. That's good. That's very helpful. Anyone else want to make a short comment, ask a question?
I just want to say that I'm,
For the record,
for the record, Brenda Siegel from End Homelessness Vermont. And we are, a lot of what I just heard is also what I had heard from the CAPS and am comfortable with. I continue to not quite understand how statewide organizations, because it's a lot to plan with 5 different groups. So I'd love to sit down and figure out if there's a possible way to make sure that that happens.
That what happens
So
exactly?
statewide organizations to have to go to plan to each local community is actually quite a lot of work for a small organization, but that is statewide. So
You're gonna solve all those problems.
no, but I feel like there are ways for us to make sure that we're meeting maybe with all the caps or doing something. So I think that we can sit down and have a conversation to
Got
figure
it.
out if there's some language that would make sense. Since we do statewide disability work.
Yeah,
And then the only other thing that I was unclear about something that just was said, but I was addressing a fair hearing on my email. So I was following after Commissioner Winters. I'm looking at my email. But I think that we want to make sure that the assessment is very human centered. So however we come up with that, in ways that we do complicated assessments with people who have complex needs and especially people with psychiatric disabilities. And we want to make sure that the assessment is done in a way that makes people very comfortable. And so that so that if it's something they can't do, that's responsive.
okay, well, so you have specific concerns for your organization. Obviously, what we'll continue to look at is sort of the oversight
Mhm.
from the administration, and there may be some input here. I know that happens. We will keep this in tune.
Okay, and to clarify, it's not, the second concern was not for my organization because we don't serve
I
every
get it.
client
It's
with
for the
disability,
individual.
people with disabilities.
Yeah,
Yeah.
yeah. Okay, so I'll make sure that the assessment that does happen is consistent with what you're seeing.
Yeah.
In some way. Okay, thank you. Anyone else for the record?
For the record, Beverly Bogat, the Vermont Early Childhood Advocacy Alliance. I'm not necessarily responding to what I just heard here, but I just want to plant a seed about something that either this group could look at in the hallway, or the cafeteria, or maybe this group would want to discuss, but I'm planting a seed around reporting and data and information.
Reporting what?
Beyond the needs assessment, but
Wait, reporting what?
reporting data. So right now we have robust reporting around
Yep.
how many people are served in the GA program, in what region. There, weekly
Right.
reports, monthly reports.
Yeah.
There's also robust reporting around HOPS.
Yeah.
And I don't want to lose that. It's really good planning and policy information. The legislation is a little silent on that right now.
Okay,
And just want to plant a seed that through the transition, we don't want to lose some of that data and reporting. There might also be some other data and reporting. And then how do we figure out what, when it's combined, seems to be an appropriate and the right amount of data and reporting. So we just don't want to, I think, lose that rich policy and oversight information.
right. And where it goes and how it happens and who's using that's important. Thank you. Okay. Well, so. Good. All right. Terrific. Thank you all. This is helpful. And some of what you're asking are things that we need to take steps forward on. We need to get there first. Some of the things that we can act on fairly quickly. I'm thinking about, we can get to October 1st. That's going to be great to get something happening, and it will help us. Absolutely. Period. So, any questions, committee, for this group? No? All right, they're going to keep us honest. You know that. So, Katie, thank you. Katie and I had a short discussion the other day about some decision making, but I think what we're hearing today is going to help us with that hugely.
Good morning,
Good morning.
Katie McLean, Office of Legislative Counsel.
So we just heard a lot of the question about some of the questions that we were asking. And maybe you could help us with where we are on our decision making.
Sure.
Okay.
Well, we'll see.
Yeah, we don't know where
There
we
may be
are.
ways.
We do. I can go.
Too enthusiastic. So I also have to apologize. I was in a, to another committee, so I meant,
Don't apologize.
the
Like,
first half
this
of
is
the
a difficult
conversation.
time of year. We understand that.
um,
I'm glad you're okay.
so this is what I'm hearing, collectively from the conversations we've been having. And if I've misstated anything, tell me. So I've heard several times there's an interest in adding language about reduced reliance on hotels and motels.
Yeah, and transitioning to a new use, which I think is in the bill,
Transitioning to a new use, meaning.
for those hotels or motels that remain.
Okay. That you're maintaining the 5-region sort of system, for lack of a better word, that came to you from the House, with the community action agencies taking the lead. But they are not necessarily the ones providing the services, that they're potentially contracting for the services. I am hearing that instead of one oversight or advisory committee, you're looking to regional advisory councils. That language would likely take effect before the other language, this July, so that the various regional groups can have time to provide information as soon as possible. And that the membership would be sort of flexible in those regional groups, that it would may include various service providers. Yeah. So I can pull together language that's fairly inclusive. I'm hearing that you want performance benchmarks, but we don't yet know what those performance benchmarks are. So I feel like I maybe need more guidance as to how we will come to get those benchmarks. I'm hearing that there will be maybe 2 reports, that you're sort of tiering the reporting requirements, and there'll be a report back in October and another report back in January. And that both reports will be coming from the department, but they will be in collaboration with the regional advisory councils. Is that accurate? Okay. So I can look at how to sort of pull apart the various reporting requirements that are in place now to try to understand what is going into which report. And I feel like I need some clarity, and I think you probably discussed it when I wasn't in the room. Are the developing the performance measures, is that a task of the regional groups that is coming to in October? Or
And now this is a very good question. I think probably there should be some consistency across the 5. So I'm thinking about 2 things. I'm thinking about assessment and then performance outcomes. So some of it will be regional, but some of it will be common across the state.
Okay.
So that, and I'm looking behind you at the commissioner and others to try to figure out how do we put in place an assessment program? Who collects the data? How is the data collected? How is it sort of consolidated? And then how do you use that data locally? And then similarly with benchmarks.
Okay.
And where's the data collected? How's it collected? And how do you determine a good outcome? Go ahead, Commissioner.
Sure, Madam Chair, for the record, Chris Winters. I think that's something we could put into the October 1st report, is what are the outcomes we are looking for? How will we measure them?
Okay.
That would be a recommendation in October. And then the regional assessments would be, what's the process for the regional assessments? Could be in the October report. And then the regional assessments would happen after that.
Okay.
And as part of measures and outcomes, and we could include the data piece that I think.
Is that something that actually could happen by October?
I think so. The CAPS have spoken about, there are national performance indicators that they're helping for a lot of their federal grants. We do this for OEO with the grant and the HOP grants, like what does success look like? I think we could do that for an October 1st report.
Senator Brewer.
Thank you, Chairline. Getting back to the performance measures and how they might differ from region to region. In a region like mine, let's say, that's fairly, heavily populated by Vermont standards. one of our measures might be that, shelter beds are spread out throughout the region. Which might require like a mandate of some kind, I'm not sure, or tied to bus routes, for example.
Housing
But-
mandate.
Yeah, but that may not be, proper for every region, so.
Yeah.
Will there be different, sets of performance measures for each region?
I think there are probably some general statements you could say about access that could apply to every region, depending on whether you're a more rural community or you're a community. And often you want to cite shelters where they're close to services. I think there are general broad guiding statements that we could put together with the community action agencies and public input as to what that would look like without be so specific that it would handcuff, a particular community for their particular needs.
Yeah, so in some of the, obviously, housing is a huge social determinant, but also is transportation and how people get to their shelter and then back home when they've got a more permanent place to live. Those things seem like little things, but they're hugely important. And that will become part of the decision making on the appropriation or allocation of funds that CAPS has. Oh, boy. Yep, so there's a lot. Okay, Katie.
Okay. So just to sort of recap where we are, so there is language
On page.
on page 13 of the bill about regional planning and needs assessment. So what I'm hearing is that you're still sort of maintaining that concept that you will be doing regular regional planning and needs assessment. But for planning purposes, the October 25 report will have process for conducting the regional assessments. But the regional assessments won't be done for October. And then the second piece of the October report will be performance benchmarks, which will have some sort of standardized assessment measures, but also some regional specific ones, including access across the geographic distribution. So does that sound accurate?
Does, and then it's how they flow together, I guess.
I'm wondering the same thing.
Yeah,
For example, is there a regional assessment that's done before the program is up and running?
yeah, I mean, it would seem something has to happen in that direction.
Would that be January? That by January, there's an initial regional assessment that has been completed?
We're gonna need the feedback from you guys, if that is possible. We're saying yes, okay,
It needs to be longer.
Yeah. Probably,
saying yes or
Longer
no,
runway.
are we saying yes or no?
26.
I'm saying January, I'm sorry, Amy Schallenberger, I think January might be too quick if we're only agreeing on what the assessment looks like in October.
Okay,
January, like, just being aware there are so many holidays between October and January, and you're trying to
Okay.
pull together stakeholders in a real inclusive way. I think you might need to give a few more months. for that.
what works? February, March,
I'm guessing April,
oh boy. I mean, look at, think about it.
because I think DCF would also have to approve them all, like there will be the doing of it and then the approval of it. I don't know how long that would take.
So think of this, okay, next year's 26, we're doing the 27 budget. And if you look at the little suggestion that was made to us that you all have agreed to is 27, this stuff goes to the caps.
Yeah.
And so we're gonna have to have something in place. There very well may be something that goes in the budget with some policy direction. So think about that one and bring it back to us. I don't think you're gonna make a decision right now. This is a decision point that we need, and we need to think about how we can make it happen. So it fits in with that 27, 28 timeline.
Thank you, Chair. I'm just wondering if some, not a lot, but some of this work might already be done and it just needs to be kind of like brought together in an organized way. I don't know, it's a question, not a statement.
May I answer that?
Yeah.
I think what's true is that if you really want to have a transformative experience, we can't just take what we already have and give it to you. I think there needs to be, and I think the CAPS are excited about having conversations in their community with the current stakeholders and new stakeholders to think about what could we actually do with this money in the community to change what's happening.
Yes.
And I think if you want that to happen, there's time, because people that haven't been participating are going to need to be invited in and feel like they're welcome in that conversation. So
I get you. That's part of the discussion you guys are gonna have to have. I'm not gonna solve it all. I'm looking at my joint fiscal person here who's gonna solve it all.
Oh. For the record, Bill Knight, Joint Fiscal Office, I think the chair made a good point though about budget. DCF is gonna have to come in January with their budget. So they're gonna have some placeholder for what they think the cost is gonna be. So you have to think about what the budget needs are, and it could have a preliminary, cost. Then you could have maybe a progress report in January,
Yeah,
and then they have to work within the budget for their plans, I guess.
Yeah.
I don't know, you have to, so you could have it 3-tiered like
Yeah.
that.
gonna have to be tiered approach like that, because otherwise we're gonna leave things till the end and then we're gonna have to continue to plan and plan and plan and nobody is. I'm not excited about that thought.
So maybe have a January 15th report.
Yeah,
Report
yeah.
back on progress report.
Progress
Legislature, where things are at.
and then we might be able to sort things out during the session in here and down the hallway. This is next year. Ooh, getting exciting. Yeah.
Okay, so may I recap?
Yes, all
Okay,
yours.
so on October 1st or October 15th, whatever you choose, there's going to be a report with the process for conducting the regional assessments. And then after that, sort of framework is put in place, then the CAPS will work towards conducting those regional assessments for the purpose of coming up with a plan. The progress report on the regional assessment and resulting plan comes to you January 15th. That's the progress report. And then on April 1st, there's a final report that is within the budget that they built into their January 15th report. Does that sound accurate?
April 1st. Does that work? Look, this is, I'm not making a decision on this. It sounds like a proposal that we're gonna have to hear back from. The sooner we get it, the better. Included in the assessment, we also have the performance benchmark discussion.
That will be part 2 of what's coming in October, but I have a follow-up question.
Okay.
So page 13 of the bill, you have language on regional planning fees.
Yeah.
So my question is how, in light of sort of this structure that you're putting in place that takes effect before VHARP is in place, what are we doing with this language? There might be an interest in retaining some of this language, with the idea being that there would be ongoing regional assessments and planning every few years. And it might be, it says that the plan shall include housing and, the plan shall include, and then there's a list of everything that the plan shall include. So that language could be moved, to this more temporary language to guide the creation of the process for a regional assessment. So you're not losing the language, and then what would be in the VHARP statute itself would just be language saying to sort of maintain this on an ongoing basis.
Yes, but it will be refined through the initial process for October, January, and then the final. So that would mean we'd have to have final statutory language next year. What the CAPS would be doing
Um,
for the advisory.
oh, I see what I mean. What I can do is sort of put broader language in place that would work if you
decided to
if
leave
you
it.
decide to leave it, but if you decide you really like or don't like what's happening with
Right.
the regional assessments, then we can
So,
more specific.
yeah, and along those lines, right now, it's regional assessments, you know, and how working with state partners and what questions about permanent housing, what's needed. I'm just reading what's here. Resources. Maybe, should we be more specific, including types of services that might be assessed, needs assessed, for example, financial assistance, so it's housing, financial assistance, mental health, residential, you know, care, substance use disorder, some of those things, which disability issues, proximity to healthcare facilities. I mean, there's a lot there that isn't there. And just to leave it so general.
Okay.
And I know that everyone who's doing this work gets it. They know all of that. But our intent is to make it as comprehensive as possible. And I agree. Yeah. That's a good idea. Yeah.
Okay, I can see what I can do.
Okay. You always do great.
Well, it can always be improved on. I have been tinkering with language, and I have been working on sort of a reporting section.
Okay.
And I'm also, as I'm putting this together, thinking, you have been, do you remember a few years back where you created, I think the department calls it the June cohort? It's not referred that way in statute. But there was, is it the June cohort? But there was reporting in that section that was pretty robust, and we've carried it forward.
Yes.
So I'm wondering if we pull that reporting language and, you know, modify it for these purposes, because, and then I think it's monthly. So I had sort of been working with an annual report, but maybe you want something more frequent.
Just updates. Updates and reports.
Okay, so I will
Good
look and
idea.
see if I can modify that.
Yeah,
language.
so there might be a lot of people who want to provide them to join this school.
The monthly one, it did for a while, and I think it's been going to policy committees.
Yes.
Okay.
Now, this is exciting. Can you tell us what just?
The judge has released the detention Palestinian reminder.
Oh, yay.
Yeah. Very good news.
For some of us, that
Love some Madawi.
okay. Sorry.
Should I keep going through my list or?
Yes, please.
Okay.
This is great.
Is it helpful?
We aren't going to resolve our problems here.
Okay, so I'm hearing also, that there at least has been a conversation, if not a decision from this committee about, that the CAPS would sort of be authorized to do this work, assuming they meet certain criteria, and that they might
Yeah,
lose authorization if they can't
Yeah.
fulfill. So add that in.
right. So we don't know what those criteria are yet. But who do we leave that decision making to? I guess the group that's out there. Who did we put it?
I don't know if you're looking to, how much of the house language you're looking to preserve, but they do have a section called,
Where is that?
I'm looking, let's see.
Past the advisory committee.
No, it's before the advisory
Is it
committee.
okay?
It's duties of the community action agencies. And so there's already some language that the House has provided that you could consider for that.
Is it in
There
the
it is, at the
transition?
bottom of page 9.
Oh,
So some of those criteria of 9, and then the list is on 10. They have existing or planned infrastructure to support households in the region, including an established leadership team, human resources staff.
which one? Oh, duties. Okay, sorry.
Yeah, I'm sorry, I'm on page 10.
Yep, got it.
Subsection B.
Yes.
They have the ability to meet the department's reporting requirements, including a past history of reporting requirements. They have community connections with other providers in the region, including local housing coalitions, housing providers, providers of coordinated entry, providers of services to individuals who are older Vermonters, individuals with disabilities, substance use disorder, mental health condition, individuals re-entering the community after incarceration, transitioning from care and custody of Commissioner of DCF and family children. They also have the ability to provide in plain language communication with households receiving services. I might also say, add a line that says they have the ability to provide the services required pursuant to this chapter. But that's maybe a starting place.
Well, or that the organizations within the region will provide, they shall provide services.
Yeah, that's a good point.
Yeah.
They can ensure that those.
And if you don't, if you've got, suppose you have a service organization that doesn't want to do it.
Well, do we know how many of the caps meet these criteria? And
Well, ask,
when and again, when we say the local, I'm quite sure, we have two problems. We couldn't open up local shelters because we didn't have staffing.
Yeah.
So they have the ability, but no staff. And you have the ability, but how much of that ability is tied to, but I need financing to do it?
and so this, yeah, so where you're getting to is the 27-28 transition where we're looking at taking that 30 million motel hotel and some of it.
Yeah. And is that enough? Because I would doubt that we are not going to need hotel motels at some level. Just because of the time it takes to build out a shelter.
And there are hotel motel rooms sort of directed to be used in a slightly different way by the CAPS.
Yeah.
Okay, well, so Katie, what you've identified here is the duties. But so part of the duties, we should think about this. We'll have to go through this individually and then together, but meeting benchmarks is the way, they're successful.
Well, that could be another item on this list.
Yeah.
That they have met, benchmarks. I'm
How do you
struggling, well, because they're coming back to you on a report.
The outcome.
The benchmark, but they're coming back to you on a report. You haven't adopted.
Yeah,
one.
we're gonna look at that.
But I guess you could say something like any benchmarks adopted by the General Assembly. So then
Yes.
if you do go back and put them in statute, then we're referring to them. Any benchmarks established.
Okay. We can't solve all the problems in the bill, but if we don't want to.
Cafeteria group needs to sit down with this bill and mark it up. I think the cafeteria group needs to sit down and mark.
Yeah, they are.
Because we're just asking to hire 3 people to do all the reporting. We're asking them to do that. I mean, the more they have to do for us, the less time, money, and personnel they're gonna have to deal with the problem.
Exactly. Okay, so that was another one. Is there something else?
I think I honestly feel sort of optimistic about this information I'm getting, that I can build something responsive to this, and I feel like I'm sort of working through it in my head and have a structure in place to what it might look like. So I don't know that it's a hugely heavy lift. I know that there'll be pieces to still work out, but I think this is all within the realm of possibility.
That's really good to hear.
Just want to make sure we don't step over into fantasy land.
Right.
I think some of the language, we've talked about how you want the OEO funds not to move until fiscal year 28. And I think we're gonna just be doing some juggling with our legislative language.
Okay.
And just have to put in sort of the purpose section of the bill that beginning in fiscal year 27, we're moving the GA money. In fiscal year 28, then OEO money becomes part of it.
So what we need is another piece of information about how that transition will take place. We're gonna need some updates in 26 and 27 for how that OEO, how those OEO funds will combine with CAPS. We're gonna need that, something in there that's,
We will need a little more
Yeah.
guidance on that piece.
hate to use the word report. Want to use report, but.
We have a presentation about,
Yeah, it's a presentation about how the, and it could be a budget. It could be within the budget itself, and then any policy recommendations.
so as part of the FY 28.
Right, so that will happen not next winter, but will happen in the budget of in the 2027 year to 28.
So it'd be DPF presenting when they're
And
presenting
in
their budget
and I, yeah, but
in collaboration with CAPS.
yeah. Yeah, it's gonna have to be.
And the point of the presentation is how the transition hot funds to be part of VRED.
Right, any administrative, or organizational changes needed to accomplish the goal of combining POPs and CAPS.
Okay,
Cat POPs.
I can add that. And then another piece that I just am struggling with a little bit is,
Is there a page number?
not really,
Okay.
I'm just thinking through all of the reporting requirements.
know.
Not like, I'm not making a statement about
Too many.
the quantity. It's more like for the regional reports, we're referring, let's see, they're already reporting. Says as part of the report, as part of the plan required pursuant to Title III. So that's the report that they're already doing.
Mhm.
And the federally required planning needs and assessment for the continuums of care. They're doing this needs assessment report on an ongoing basis.
Right.
And you're also getting a report from the department on an ongoing basis. Which is probably fine. And then prior to these pieces taking effect, you're also getting information in a tiered approach regarding sort of the ramp up planning for the implementation.
Should we be asking the CAPS and AHS how to integrate all those reports so they're not doing a whole bunch of little ones, but is it possible to combine information so that once we get there, it's an ongoing annual everything?
Sure. You're looking for sort of monthly reporting from the department.
When?
We just talked about taking the reporting requirements that have been integrated into GA that are coming back to the.
Oh, that's the GA monthly.
Yeah, we're turning that into the VHAR monthly is what it sounded
Do we
like.
need VHAR monthly? I mean,
I don't know.
maybe for the first year, but then after that, if we have that's a question I'm looking at the commissioner and others, is there a way, to gradually wean ourselves from all those reports and then combine some of those things so that we're not setting up the Department of Reports. Commissioner.
We've gotten into a pretty good routine about providing that Act 113 housing GA report.
Yeah.
And include elements of shelter in that every
Okay.
month as well. So I think that's probably important through the transition period, but yeah, we'd love to eventually, when we get to a place where
It could
it
disappear,
could
or become
be less frequent.
less frequent.
Yeah.
Cats could disappear. No, but the strike of an executive Sharpie. I know. That's true. Which is why we trying to preserve the local organizations and the structure.
We may be
Yeah.
looking at a lot more
Right.
6 months from here.
I think we've got enough here to cloud this, form a lot of gray areas. So we were feeling pretty good in the beginning, and now we're getting to a place where we need more decisions, and frankly, we need help from all of you, getting together around the cafeteria table.
It, just so I'm clear, we've done away with the housing version on the Commission on Future Public Education, which is this huge state advisory committee. And we are going to regional reporting and planning groups. We might have got that right. Okay. And these. And now we're on, what are they going to report back to us? I think part of what they should report back to us is an anticipated budget. Because I'm going to assume that they're going to have to work with our local mental health. I know the home health people are providing health care.
Dale, EMA,
Yeah.
Yeah.
Dale,
DOH.
we do a better job of funding our state agencies than we do our community agencies. So I think we also need to get a needs assessment. They could work with mental health if mental health can get 3 more social workers, or the state can provide 3.
The issue that you're raising is really important, because we want to have one budget request that will cover the needs across the state. And so there needs to be a funnel of some type that collects all of that and sends it to the budget. And who does that? And how does that happen?
And
I think it's an administration question. And that allows for administrative oversight. And then it also allows for legislative oversight through the budget process.
And the other one is what happens. These CAPs all have boards of directors, which unless federal law has changed, there's representatives from different groups. And what happens if a board of directors says, this is just more than we can take on right now?
That is the opt-out piece. We're talking about the de-designation piece there, and we haven't gotten that far yet. But a backup plan should CAPS not be.
They don't have to opt in. We're just signing this to them unless they opt out.
Well,
That may be overreaching our power.
well, we'll listen to the CAPS. So far, I think I'm looking at Amy, your response to that question.
For VCAP, I think it's very safe to say at this point that all 5 CAPs would like to do this. They feel like they would be able to with funding for the transition. And I think the conversations with DCF and OEO have been very productive in what would be needed in order for that transition to happen successfully. So still more things need to be worked out, but I don't think at any point there's any of the 5 CAPs are thinking they do not want to or cannot do this.
So the only de-designation would happen with outright failure or some real changes in what we're here. Okay. But the point you make about the budget is unbelievably significant. It's see a mess out there if we don't do something.
And the budget has been the problem, what we've been dealing with at the state level. I mean, I've said my piece about,
We won't don't think about that right now.
Yeah.
Yeah, you're right.
we will assume we're acting in good faith.
Katie, is there anything else that you think we need to be? Oh, there's a lot, but so, anything else at this point?
I think I can
Begin
throw some spaghetti at the wall.
that, okay. And we'll get Meatballs.
It's a good definition of what we do.
We'll get sausage. So that will be good. I think this is a good place for us. This has been a good day. I feel like it's been a good day. Every day is a good day, but this is particularly good. And I again want to thank all of you folks who have been engaged in helping us improve the bill. And I think we are trying to make improvements, and we do want to maintain a relationship with the agency, DCF in particular, and with our other providers in each region, so that it's an inclusive process. Period. So,
Process question, super quick.
I'm getting there.
Okay, good. Then go ahead.
Process wise, Katie's gonna go out and work.
Okay.
Process wise, there's gonna be a big meeting somewhere in the cafeteria or other. And then process wise, we're going to have folks come back to us. And I'll talk with Katie about what her timeline is, and we'll be using her timeline as the timeline for everyone in the room, because we don't have a lot of time. Senator Douglas.
So do you think there's gonna be another chances to go on this for more public meeting? Because I have a handful of things for us to talk about, but she has enough from, I think, just today to go off.
What are your questions?
Well, not really questions, just other things that I think we should talk about, points to mark, stuff that we've already talked about in committee mostly.
Okay, well,
things
listen
like
for us
these,
right now so we can say, yeah.
Yeah,
Please
so-
Don't hold up, please don't hold that.
Well, I don't want to give Katie too much
No,
today.
no,
that's
you're
why I
not
asked
giving
her
her
number.
anything. You're sharing with the committee what
Yeah,
you're
so
thinking.
data collection, we talked about that.
Yeah, we got that.
Back, I think it was before COVID, when they were doing the hotel partner merger with DCF, would do verification of homeless status of people.
Yeah, we got that.
And then I know I've spoken to my local community action group, and they do diversion stuff. So if somebody has the ability, if they have family that's willing to take them, they'll make phone calls, or
Yeah.
they'll do bus tickets or plane tickets if somebody needs to go somewhere else.
Yeah,
And then we talked about this a little bit or a couple weeks ago, and I'd love to see specific language to ensure that the apps are including local faith organizations and philanthropic organizations.
got that.
Might be able to-
Yeah.
Yeah.
Yeah, because, especially if the local church is doing soup kitchen,
Yeah, no.
the CAPS don't need to open up their own kitchen. And this one's more of a spitball, but it kind of have an optional thing for the CAPS to implement some sort of, I know this was included in the task force report, but whether or not we should ask for some sort of payments from people, small numbers to offset budgets. If budgets start getting strained and we don't have enough money from the state,
And
optional.
that's part of the discussion, I think. Oh, some of the things you're talking about are part of the discussion about eligibility, and then how the housing takes place. I know that is an ongoing conversation, but no, those are all good things that we will have to look at. I'm not sure. Well, we might see them in the next one. Well, certainly the folks around the room will be thinking about this, including DCF, and some of that stuff is alluded to in the bill, or we've talked about.
It's sort of, as right now, the bill has a big report that comes back in January, and a lot of those decision points are part of our decisions. You're going to receive recommendations back on, and I was going to move some of those reporting requirements around to tier them between December and January reports.
So, yeah, we'll look at the language and then we'll decide how we want to deal with it on each of those. Those are all important. Good. Glad you brought them up. Anything else? Thank you, Katie.
You're welcome.
And thank you, Chris, Commissioner, and thank you, everyone. Appreciate your indulgence and your focus. But we